This program and its contents are designed for information and educational purposes only. This program does not render medical advice or professional services and is not intended to be a substitute for professional care. The information provided here should not be used for the purposes of diagnosing or treating a medical or psychiatric condition. If you have or suspect you may have a health problem, consult your healthcare provider.
Hi, welcome to Positive Momentum TV. I'm Diane Silva, and today I have Dr. Andrew Rivera, a chiropractor from the local Omaha area. Dr. Drew, could you tell me a little bit about yourself and your practice?
Yeah, well, first and foremost, thank you very much, Diane, for having me on your show. It's an absolute pleasure. And I've been a chiropractor now since 2008. I was born and raised in Omaha, and I found my way back home. I was practicing in Pennsylvania for some time, and then now my wife and I both practice in Papillion.
Awesome.
Mm-hmm.
And why do you do what you do?
Well, that's a really interesting question. I guess the only way I can really share that why is by explaining a story.
Okay.
It wasn't until my second year in chiropractic college in Life West in San Francisco when I got a phone call that my father had a stroke.
Oh.
The stroke was pretty severe, and it left him incapacitated for about 18 months before he passed. He wasn't able to speak. He wasn't able to eat, walk. He basically was trapped in his body for 18 months before he passed. Why I do what I do is because your health is your top priority. It should be your number one asset, and there's a lot of people that take their health for granted, right?
I'm one. I do.
So one of my big whys is that I see my dad in a lot of people, and if I don't voice what it is that I know, they may be, them or their family, the ones that they love, may also not experience the health benefits that they are innately born with.
So could we elaborate a little bit on how chiropractic can contribute to that wellness and that health?
Chiropractic really, Diane, has nothing to do with neck pain or low back pain. Exclusively, I would say, in the United States, that's the misconception that I was involved in a car accident, so I need to go see a chiropractor. I've got low back pain, go see a chiropractor. But chiropractic really has nothing to do with the musculoskeletal. It has everything to do with your nervous system. Your nervous system controls and regulates everything in your body. And if that nervous system isn't functioning at its peak, that's how dis-ease begins in the body, and that's how the breakdown starts to occur with health issues.
Wow. So what would chiropractic be able to do to contribute? How do we, I guess what I'm trying to say is, as a tool to wellness, as a tool, you're talking dis-ease, we're talking migraines, we're talking, even weight issues are a form of dis-ease, anxiety.
Sure.
Any kind of, and I know you specialize right now in the nervous system. So if we could, let's start there. Let's go on to that, and we'll come back to the specifics.
Yeah. So as far as the different types of symptoms, right?
Okay.
There's multiple, many different symptoms which someone may come to my office for, right? Or see a chiropractor in general. But the chiropractor isn't necessarily looking at the symptoms as something to treat. That's what you would go to a medical doctor for.
Right.
In a holistic model, which chiropractic falls into, it's more, the holistic model focuses on the healing from the inside out.
Okay.
That's where chiropractic resides, whereas medicine is an outside-in approach, right?
Okay.
So circling back to your question is, what chiropractic for different symptoms, what a chiropractor will look for is strictly how your nervous system is functioning. Now, there's a specific test. We'll go into that a little bit later, or I'll demonstrate for you of how I can test your nervous system. And there's different things that we can do besides X-rays and objective measures. But if the nervous system is functioning at its best, it lays the foundation for health. So that's how everything else starts to improve.
Ooh, I like that. That's more information on the chiropractic care. You had mentioned that there's several flavors of, or various flavors of chiropractic care. Could you kind of elaborate on that with me?
Yeah. Well, there are many different types of techniques in chiropractic.
Okay.
A lot of the ones that maybe everyone's familiar with is just the hands over a full spine. But there's many different other type of techniques, such as instruments, a drop table. So there's different ways to adjust a spine, right? Okay. What I focus on is specifically the upper cervical. And the upper cervical spine is basically the top two bones, which I showed here. So what I look at is how the top bone, which is referred to as the atlas, is in relation to the occiput, which is above it, and the second bone of your body, which is the axis. So this is very specific because 80% of your neurology resides up in this upper cervical spine.
So could you kind of give me an idea where this is located on your body or my body?
So if you were able to just feel the big kind of bump in the back of your head, you just slide down just a little bit, and that is where these two bones reside. Your brain stem actually sits right on top of this, and then that's where the spinal cord will then innervate and go all the way down to the body, right? So I look to see if this two structures are in perfect alignment or if they're off. And if they're off, that's what we refer to as a subluxation, and that's what really starts to change someone's neurology and affect the nervous system.
And why would that happen? I mean, why? Okay, let's just say why. Why does that
How does
occur?
this happen?
Yeah.
And it goes back to what we discussed before. It could be a multitude of different things. Traumas, toxins, your different emotional stresses. It could be positioning, how your ergonomics at work, sports injuries. You can name multiple different things. But it's supposed to move, right?
Right, okay.
But the problem is, if it gets fixated and it gets stuck, and once it gets stuck, that's when, but here's, you can't feel it. You can't feel your nervous system being affected.
Understood.
It's like you can't feel arteries in your body clogging, right?
True.
Okay, there is a professor at the University of Colorado, Professor Su, and he did his study, a PhD, on the amount of pressure that it would take to shut down a nerve, a spinal nerve. And what he concluded was the weight of a dime would shut down a spinal nerve up to 60%, more than half.
Wow.
And so if you put into perspective, this is Nebraska, it's cold weather. What if your heater was only working at 40%? You would still be living in your house, probably really chilly and cold, and not comfortable, but you would still be surviving. And that's kind of what happens along with this. Like your nervous system will still be able to adapt, but it's not functioning at 100% capacity. Does that make sense?
Right, so how do you tell, I mean, I understand you use some instruments to be able to check this out.
Yeah.
Can you tell me a little bit about that?
There is a specific test to identify if your nervous system is functioning at its peak or not. And what I use is a computerized surface thermography. It's an infrared surface thermography scanner. And what it does is everything has infrared, right?
Okay.
This table has infrared, this thing is having infrared, so it emits infrared. Military uses infrared to see in the dark, right? So if there's any type of interference to your nervous system, if your nervous system is affected in any way, this machine, this test will actually come back and I'll be able to read it and I'll be able to see that your nervous system isn't functioning the way it's supposed to.
And that'll show if these are out of alignment or in alignment or whatever.
Well, that's a good observation. The scan itself will not show if it's if the structures are off alignment. That is what a radiograph is for, spinal radiograph, X-ray. That's what X-ray is for, to determine where there is that fixation, right? The scan, the test, is actually to see how well the nervous system is functioning.
Okay. And can we do a demonstration on that?
Yeah, absolutely.
Okay. Well, we're going to go ahead and take a break for a moment, and we're going to come back and we'll show you the demonstration on this instrument and check someone's nervous system. Okay. Hi, and we're back with Dr. Drew. We're going to do a demonstration on getting my spine checked, and Dr. Drew is going to take it from here. Dr. Drew?
Okay. Well, Diane, this is exactly what I was talking about earlier. This is this instrument is called a computerized infrared surface thermography. And what this does is it will test your nervous system.
Uh-oh.
Okay? So it's very simple. Through these barrels is where the infrared will come out. It'll bounce into the pores. It'll actually test the surface temperature and if there's any nerves that are being affected.
Okay.
It'll come back into the machine and we'll see it on the computer. Okay? So let's get started. You just feel, I'm just going to brush the hair, but I just want you to sit up straight. Very good. Perfect. And we're just going to scan up, Diane, just like this. Perfect.
Cool.
Okay.
Wow.
Good.
Very squiggly. Cool. So what we did is we just basically one of your scans. You said that you do this multiple times to get a good reading, a baseline to be able to judge and test.
In a clinical setting, you would want to obtain multiple scans and not just rely on one, right?
Okay.
But on this scan in particular, if we just take a quick look at it, you'll notice that it's broken up into 3 different segments. You have the left, the right barrel, and then this is the differential between the two. Okay. So when you look at these lines, they're squiggly, and what you want them to be is balanced and symmetrical. Okay. So if they look equal, that's a good sign. But when we look at yours, we can see that I could not overlap the left barrel to the right barrel, and because I can't, you start to see how it goes in and out, in and out, right?
Okay.
So, so your nervous system is not functioning at its true optimal potential. Well, the scan on you, Diane, showed that your nervous system wasn't functioning at its peak, right? At its true optimal potential. But you sitting here right now, I mean, you're able to function, right? It's just that you're not functioning at your best. So if you, this is the best way, every single time I see someone who comes into the office or I speak to someone in the streets, I always, what would you do if you were able to improve your health, even if you're at like an 8 or 9 out of 10 right now, and if you can get to the 10 or to the 11, you know, like your body would just magnify with healing.
I wouldn't know, and I'm assuming you know the answer to that question because I don't know it. Because my evolution of being a chiropractor, I was once a full spine chiropractor where I focused primarily on the entire spine. But based upon my evolution, of being a chiropractor, I've more specifically dived into the upper cervical component because this is, like I said, where all the neurology is. This is where all the miracles
occur. The type of people that come to see me in my office aren't the low back pain, is not the headaches or the migraines. There are a few, but for the most part, upper cervical care is basically for some of the sickest of the sick in the public, because this is, like I said, this really, truly improves the nervous system, and your nervous system is the master control system. So the type of people that you would see if you came into my office are the ones who've gone to the Mayo Clinic, who in particular, there's a patient that I've had who has been walking around for the past 2 years at 102 temperature.
Holy Moses.
For 2 years. And she went to the Mayo Clinic and they said that's just your normal temperature. But it was so, she just didn't know. She knew that it was not right.
Right.
And since being under care, guess what do you think? What happened to her?
So I'm assuming, or you wouldn't have brought it up, that,
Yeah.
that her temperature has come down closer to a normal
Yeah,
range.
You're right. And she had no neck pain. She had no low back pain. It was temperature, which is regulated by nervous system, right?
Wow. So what kind of care would you provide? I mean, I'm just trying to get a picture of what it would be like. Let's say we did the scan. Okay, we did my scan,
Yep.
and we found out, what would I expect to walk back into your office and say, and we start taking care of, or
Yeah. Oh, that's a great question.
Okay, yeah.
So if you came into the office and we got the scan, I got the results, and I know that your nervous system is affected, then I would tell you that I would be able to help you, because strictly I could help you improve your nervous system. How the process gets started is I would just look to see how your spine, how your full spine, more specifically where this is fixated, so that I will know specifically the right direction to give you this adjustment, okay? The idea behind my care is you're not supposed to get adjusted every single time. And in fact, I would love it if I would give you one adjustment, and that's the only adjustment that I have to give you for your entire life.
That'd be
The
nice.
idea is that you have to be checked. And I bring this up because you go to the dentist, yeah? Mm-hmm. Does the dentist drill in your teeth every single time that you're there?
No.
What do? They check, right?
They check, they clean, they make sure everything
They
is...
make sure everything is okay.
Right.
And that's the same thing. That's what that scan is for. So if you came into my office and we came up with a game plan, every time that you would come in, I would scan you to see if you're holding your adjustment, if you're in alignment, if your nervous system is functioning at 100%, and then if it is, I leave you alone. You get to go home. If it falls off and you're in pattern, then you would get an adjustment, okay?
Okay.
After you get an adjustment, I would have you rest, and then I would do a post scan so that we can see that it was able to change. So the way I do it is very objective, that before and after, if you do need to get an adjustment, we can determine if what it is that I did really made an influence and an impact into your nervous system. That's how people get well in my office.
And the check after is very, very different from what most of us are used to. You know, when we go into chiropractic office, I go into, I guess you would call them a full spine, where, you know, get the adjustment, but I went because I had back pain. So you're talking, okay, we went in, you know, for whatever, I felt I needed that wellness check. I come into your office, we do a nervous system scan like we just did, and you find that, okay, you've done your series of tests as we discussed, you know, you don't just do one. And you found, okay, my nervous system's off, which I could have went, yeah, okay, I'm a little screwed up right now, so I understand, you know, either my weight or my anxiety or my this or my that, and you go ahead and we discuss a game, you said a game plan. Can you elaborate more on the game plan?
Well, before I do, I want to address this one simple concept that I want everyone, like all the viewers, to really understand, is that if you're basing your health on how you feel, it's a recipe for disaster. And the reason being is that there are people who are walking around who have no symptoms, but who are sick. Yes?
Okay.
And a great example was my dad. Probably 2 days before, he had no symptoms, but he wasn't well, he had a stroke, right?
Right, yeah.
So there was definitely some cardiovascular issues that were underlying, but he wasn't, just the way he felt, it doesn't signify how healthy you are. And I think that's what a lot of people typically say is like, I feel fine. And then they go back to, I don't need to see anybody, right? Mm-hmm. And that's that reactive versus proactive. But simply, I've almost made it where this chiropractic and what I do is so specialized that that's the only spectrum that I would be able to give very relevant information to. You could always obtain multiple different types of resources like going online or speaking about exercises, and obviously there's a multitude of different things like nutrition-wise that you can do. But what I'm just saying is that it's better to almost refer those questions to the expert in their field.
Okay.
So for rehab, right? So everyone will ask me like, okay, so now this is like, what can I do exercise-wise to help me? I would be able to give you different things, but I'm not the expert in that field.
Okay.
So I would refer, and that's kind of how I operate, is that there's another individual who strictly specializes in physical therapy, who's going to do the rehab, or a personal trainer who will absolutely look at how your body is moving and say, let's do this, let's do that. A nutritionist who would say, boy, you're eating the wrong foods here, let's modify that. Mm-hmm. But the foundation, I strictly stick with your nervous system because that is for me, that's the biggest thing.
Good, wonderful, wonderful. If you don't mind, I would love to go to some Q&As.
Sure.
And then what I would like to go with as well is some of the frequently asked questions, because most of the Q&As here are due with full spine.
Sure.
And since you do have a history of full spine, I'd like to at least address the questions that came in. And one of them is it better to sit or walk if you have a bad back? And when I mean bad back, I'm assuming, they're talking back pain or...
Yeah. That's a good question. And it's pretty much up to the individual. There is no right or wrong. That's a very gray area because is it a disc issue? I mean, what's going on in the lower spine that's causing it? So movement is life. I guess the best way to put it is movement is life. If you look at a young child compared to someone in their later years, there is a huge difference when it comes to motion. The less motion in some, there's not, life is starting to get away. Does that make sense?
Yeah, it actually does.
So to answer that question, I hope I did a good job. It's just basically, it's motion. So, and it's all about the individual.
Okay, and that's fair because sometimes it's better you feel better when you stand. Sometimes you feel better when you sit. Sometimes better lie down. Okay, and would a newborn have proper alignment at birth?
They can. I mean, it's absolutely it's possible. But then again, the birth process itself, even for how natural it may be, it is traumatic.
Okay.
And even with my son, he was checked shortly after he was born, and he's been checked ever since. The idea is you're not necessarily looking for alignment. You're not going to take an X-ray on a child when it's first born. You want to just make sure that posture-wise, if the baby's head is laterally flexed like this, if they're having trouble nursing, if they're just telling you there's different signs that there's something wrong, it's not because they had a job working 9 to 5 or they just born. So there's definitely issues when it comes to the birthing process, and even when you look into toddler years and as they develop, you start to see the different even the slips and falls that occur. So getting checked from the very, very beginning allows you to live and develop to your true potential without any interruption. Does that make sense?
Yeah, and it actually answered one of the other questions, so that's working out really good. And then one of the questions people say, you know, once you go to a chiropractor, you're there forever and ever and ever.
Yeah.
Why do you keep coming back forever and ever and ever?
And that's a wonderful question, and it's because while we're in school, we actually learn Jedi Master tricks. So that's a class, so we're able to influence someone just by looking at them and saying, Diane, like, listen, you're coming in for the rest of your life, and that's it, right? There is no one in this planet Earth that has that type of power. Maybe the president, right? Maybe he can have you do something like that.
I don't even know if I do.
Is one of those questions that I hear a lot of, and I always just have to say that it's a lifestyle. So if you choose to embrace this holistic, this inside out, this healing, that you truly believe that no medication, no drug will actually cure you, you know, and I can say that because cholesterol medication is the #1 medication here in the United States, and once you're on it for forever. It's a lifestyle choice. So when people say you have to go to a chiropractor forever, the chiropractor is basically giving that option to say, listen, if your nervous system is important, it would be a good idea to continue to get it checked like you would get checked for your teeth. The problem is your spine you can never can't transplant a new one. You can't with dentistry. If you lose some teeth, they could give you a whole new set, right? Here's your dentures. You can't do that with a spine. So I think it's just a question that people are afraid of because they just don't know too much about it. But once you start to understand more about what the body is capable of and how it can be affected with chiropractic care, there's no reason why anyone would never get checked.
Well, thank you, Dr. Drew. We need to wrap, and thank you very much for being here.
You're welcome.